Hi, I'm Celine Northcott. I'm a research fellow at the South Australian Health and Medical Research Institute, and I have a background in business and marketing and population health practice. And I'm also concurrently pursuing my PhD in pediatric medicine at the University of Adelaide. So a strong focus on implementation science, combining my skills in business and marketing and population health to translate real world findings so that they're usable for the population. Thanks for having me.
And hello, everyone. My name is Alicia Barker. I'm a senior marketing scientist at the Ehrenberg-Bass Institute, located at the University of South Australia in Adelaide. And I'm actually interviewing Celine today because we met each other in our marketing undergrad class and we've stayed friends, even though we've both taken our marketing degrees in two completely different directions. So I'm very happy to hear what she has to say today.
Thank you, and thanks for interviewing me, Alicia.
So, Celine, briefly tell us about your article and its findings.
Yeah, absolutely. So my article is about exploring different message framing and visual cue techniques and how they're related to health advertising, essentially. So I'm looking at different consumer responses to social and mass media promotion, and that's essentially a pragmatic purpose to promote a pregnancy screening program. So really it's looking at the impact of different messaging strategies that we can employ to promote this novel screening program, so an omega-3 test and treat program, and what methods, I guess, work best. So in short, what we found is that positively framed messages utilizing emotional visual cues are actually more effective as opposed to negatively framed messaging styles were more effective in driving behavioral intentions to participate in our antenatal screening program. So that is omega-3 screening. And that effect was seen in our primary target audience, so women of childbearing age. What we also found as well was a link between processing fluency and ad effectiveness as well, and essentially just highlighting, how easily people understand the message simply, affects their intentions, attitudes, and awareness of our messages that we are creating.
It's a really, really interesting study, some great findings. How can your findings be used by those working in advertising?
Yeah, so I think advertisers can really look at this piece and think about how they might apply message framing and visual cues in their campaigns that they're looking to design. So we know that when using the right frame or right visual cue, this can in fact enhance a campaign. So in our case, we see positively framed messages using these emotional cues were particularly effective in promoting our omega-3 screening program, as I just touched on. And also, ads highlighting the benefits of screening, using relatable images, like healthy mothers and babies, create a compelling message. So obviously it's situational and it's context dependent on the behavior and the population that you're looking, to speak towards. And that may differ for, each campaign. But what we found is that informational visuals on the other hand, so not looking at mothers and babies, but actually, perhaps inserting in the campaign a screening form or a pathology form or something highly, I guess, wordy. Look, they might be more suitable for audiences that have a high need for cognition, so people who prefer lots and lots of information, but that just simply wasn't the case for us. So I think tailoring the message to match the behavior is really the focus here. And so whether you've got a prevention focused behavior that you're looking to promote, and therefore, highlighting the consequences of not taking action, or a promotion focused behavior, so emphasizing the benefits of taking action, can also significantly increase engagement and drive positive behavioral change. So you really need to understand, I suppose, what behavior it is that you're looking to promote. And I guess in marketing speak, that's what product are you looking to sell, or service that you're looking to sell. I think in the health context, it's what behavior are you looking to affect change upon, and then understand, whether or not you've got this positive or negative frame to be able to push that behavior. And again, it always differs. So in the context of omega-3 screening, you know, the prevention focused messages might highlight, you know, an increased risk of preterm birth if, you know, perhaps we're not screening and supplementing, or decreased risk if you are screening and supplementing. But also in this context, it's quite nuanced because we've got the promotion focus side of it as well. So if a mother is looking to screen and then consequently, if they're low in this omega-3, they could supplement, and that's a promotion focused behavior. So I think it gets quite complex, but I guess in short, what we really need to understand is that advertisers should really just understand the behavior that they're looking to change and have a look at the aligning literature to support that behavior, whether it's prevention or promotion focus, I suppose.
Absolutely. So you spoke a little bit in there as well about processing fluency. Could you tell us just a little bit more about that and how advertisers can use that?
Absolutely. So I think ensuring advertisements that are easy to understand, or, you know, have high processing fluency, further enhances their effectiveness. And I realize that, you know, that sounds really simple to us, that, you know, simply making an ad easier to understand is going to be more successful. But, you know, really in simpler terms, don't make things too convoluted, particularly in health. You know, we have very scarce attention time. There's a lot of saturation going on. So I guess this study just is validating what we already know, that advertisements really need to be clear and straightforward so that people can just grasp the main points quite easily. And, you know, ultimately it's going to lead to better engagement and positive ad responses as well.
Absolutely. So where did you get the idea for this article?
Yeah, so the idea for the article stemmed from a pragmatic need. So combining the practical applications of advertising with, of course, a desire always to advance, you know, science in advertising and health promotion. So this study in particular, and I perhaps, you know, alluded to it talking about this omega-3 test and treat program, but I guess I should give you some background. The study was really driven by findings of a randomized control trial. So this randomized control trial demonstrated a link between low omega-3 levels in early pregnancy and its link between preterm birth, so having an early baby in pregnant mums. So from there, we've got these important you know, results, I suppose, from a clinical trial that then led to the development and update of national guidelines to state that women who are low in omega-3 should supplement, and therefore that drove this test, which we now refer to as the omega-3 test and treat program. However, I guess the biggest issue here was that it's all well and good to have, you know, these robust clinical findings to then inform a guideline and then to sort of have this test developed. But if nobody knows about it, nobody has any awareness that the new test exists, then of course mums aren't going to go and have that test, GPs aren't going to know about it. So, you know, given the importance of promoting the new screening program, we wanted to ensure it had really good uptake. I guess that was a significant gap there. We wanted to effectively communicate to the public that, hey, a screening test exists and mums can go and access the test now. So I guess the project, you know, it represents this convergence of clinical research findings and health translation efforts as well as marketing, and really just highlighting that necessity between cross-disciplinary collaboration to enhance public awareness and increase, you know, the uptake of this new screening program. So really just understanding the role of advertising and marketing science in rolling out a program is really important. I think, you know, advertisers really value their role in advertising and marketing and health promotion. And then I think on the other end of the spectrum, you've got GPs and practitioners thinking about education, but I really think those two can come together to then really, you know, understand messages that can resonate with the target audience to ensure that, you know, a program is effectively communicated out into the population.
Yes, I completely agree. And I really like that your research has such a practical application to it as well.
Yeah, so I think there's no real use really in advancing science if there's no need for it. So to me, I sit between marketing and health and medical sciences. And so I have a desire to have this impacts in what I do essentially. Like I want to have a practical application in my work. I think that's what drives me, is knowing that the work that I'm doing isn't just going to sit in a book chapter or in a paper. It's actually doing something out in the real world. And so that's why I love implementation science. And I guess really this study essentially aims to do that. It's looking to bridge the gap between, investigating different message framing and visual cues, but also it's going to inform, an actual health campaign that we'll get to use. So it's, I guess, effective communication and health promotion is really crucial for the success of these programs. And I guess, yeah, the study was really inspired by research indicating, that there is some role in message framing and visual elements that play a role in designing successful campaigns. And our goal was to ensure that the program was well promoted, it was understood, and that, we can really drive better health outcomes by reducing premature births and enhanced screening, leveraging marketing and advertising spend.
Yes, and you really want to help people as much as possible. And I've actually seen your omega-3 adverts pop up on my own social media platforms as well. So just sort of seeing it in the real world is really, really great.
I hope so. Yeah, you would fall in my target audience. So that's good to know that we've got that on point.
I'm interested to hear now what challenges that you ran into with this article.
Yeah, so I think there are two elements to this question. One is the academic and scientific challenge around, setting up a study. So I'm talking about, making sure that we've got messages that are designed correctly, and that the stimuli is manipulated properly. So I think from the, I guess, scientific point of view, making sure that one, we're manipulating a message so it's correctly reflective of a positive or a negative message. And two, making sure that we can have this environment in which we're conducting the experiments that somewhat accurately reflect real world advertising conditions. And I say that with a caveat, knowing that we can never do that in a pre-test study. So, we recognize that, conducting the study in this controlled environment is always going to pose limitations on the generalizability. And so, that's where I guess a place for post-testing comes in. You've got this case for pre-testing, post-testing, and both have their place. But we do recognize, obviously, that was quite a challenge in making sure that we can elicit correct responses without, having the impact of knowing you're in a advertising experiment as well. And I think the other part about, designing these campaigns is that from a practical perspective, we also want to consider the real world implications of these findings. So we know that from this experiment, these findings are going to directly be used to inform the development of a mass media campaign. And so I think that's really daunting for me, knowing that, you're creating these experiments to be able to better understand what kind of message framing works, or what visual cues we should be putting into our advertisements, and, spending, hundreds of thousands of dollars. So knowing that it's got that real world implication here, ensuring the messages are clear and accurately, I guess, executed is really important, because we want to avoid, when we're designing these campaigns, any public backlash or any boomerang effects that we might see. So just making sure that we're being as reflective as we can to develop and inform, or I guess design a really, really robust campaign that is well accepted into the community, especially in pregnancy and vulnerable population too.
Yes, it's all really important points, and you've clearly thought very hard about them as well. Lucky last question. What ideas do you have for further research in this area?
So lots and lots of ideas, but I will stick to just a few main points. I think, and as I touched on just before, I guess the first and foremost point is the post-testing of the campaign itself. So we have this beautiful pre-testing, looking at different messaging techniques, and trying to understand which ones better elicit greater attitudes, ad likability, behavioral intentions to screen. And that's all well and good, as you know, in the advertising literature, to have some understanding of, what potentially might work so that we don't have these costly mistakes. But we're really never going to know until the ads are actually out there in the real world. And so the natural next step here would be in future research is to conduct the post-test, which essentially is now that the ads are developed and out in the real world, having that ongoing evaluation and doing the post-testing to really concretely then say, well, within the population level, this is what we found. So that's, I guess, the practical side of the next steps to future research. But I'm also particularly interested in, given I'm working in the pregnancy space, temporal orientation. So within pregnancy, I think, temporal orientation, meaning that, the timing and the relevance of the information that you're presenting to a population. I'd love to understand, I guess, its relevance in pregnancy. So, for instance, looking at messages about antenatal screening and omega-3 screening, perhaps they might be more effective if they're timed at the right time to reach women in early pregnancy, because that's when the test is available to them. And so then if we know that, we want to then make sure that we can align that health message in that critical time period to ensure that the information is received when it's most needed and most useful. And also knowing that if temporal orientation does interplay within these health behaviors, in this example is just pregnancy, that can then allow us to understand which advertising mediums, I guess, and psychographic parameters that we could apply to targeting to best reach these population groups. And, that can be applied in all health behaviors, I suppose. We know that the flu vaccine is a seasonal behavior, I suppose. And so we know that we can reach all the population during those winter periods. But pregnancy, perhaps, I guess the nuance there is that, mums are always getting pregnant no matter what time of the year, but knowing therefore what when and where to target them. So whether it's in GP waiting rooms, perhaps is more appropriate advertising spend than perhaps mass media, but I don't know that. So I think that's why I'd like to have a look into it. Yeah, so really just looking at relevant time periods to then prompt these desired health behaviors and advertising campaigns is really interesting. And then another one just more broadly is looking at the role of social norms in how we might shape behaviors and make decisions in undergoing really any health behavior, but I guess in terms of pregnancy, where are women looking towards for their advice, and is that their social network, and how can we then leverage those norms to enhance the effectiveness of health promotion campaigns? And I think, bringing that back into the advertising space, if we have this good understanding that there's this social network that women rely on in pregnancy, there's so much social media going on and so many different channels now that we can reach women. So understanding if that's useful at all for pregnancy would be really helpful to know. Yeah, I think, highlighting that, most women in the community, for example, undergo omega-3 screening might create this sense of social expectation, encourage others to follow suit, or maybe it's not suitable. I don't quite know, and that's something that we'll continue to investigate, especially in such a sensitive topic, especially when women are, finding out that they're, pregnant and perhaps not telling their friends and family yet. So I'm trying to understand where it is to reach these women at the right time in an appropriate advertising means. Yeah, so I guess, ads that promote the benefits of screening and addressing potential barriers, increasing likelihood of positive health behaviors being adopted. There's so many things that I could go on and look into, but I think, yeah, particularly the temporal orientation and social norms are probably two of interest within this area of research anyhow.
Yes, they're really important points. And it's great that you've considered them as well, and sort of the different ways that you can continue this research. It has been wonderful hearing more about your article. Did you have any other final comments you'd like to add?
No, I think it's been really nice to be able to talk about my article. I think maybe as a more general summary to the article and to the in the space of implementation science, I guess I'd really just like to say that there is a place for this type of research. We know that marketing and advertising is, extremely valuable commercially. And we also know that, preventive health is quite important as well. So acknowledging the role of implementation science and combining these disciplines to be able to better health outcomes, I absolutely think, yeah, there is a time and place for it. And I'm just really grateful that the work that I'm doing is not only able to advance what we know for advertisers, but also to create change in the community, which is really rewarding.
100%. Well, thank you for letting me interview you, Celine, and I can't wait to keep seeing what you're doing as you move forward with this research.
Thanks, Alicia.